Ready?
Ready, sir.
Okay, let me start the timer again.
Mm.
Okay. Okay, you can start.
Uh, Hello, good afternoon. I believe this is Jaspreet.
Yes, I'm Jaspreet's mom, Charmanjeet.
Hi, Mrs. Chairmanjeet Kaur. Good afternoon. I am Dr. Arjun. I am a specialty registrar posted here. May I please know what would you be like to be addressed by?
You can
Uh, Sir, I'm sorry, your voice got interrupted.
you can call me Chaman.
Splendid. So, hi, Mrs. Chairman. So I see that Jaspreet is having some issues regarding chest pain for the past couple of days.
Yes, doctor, yeah.
Right. So could you please tell me more about that? And
Yes, like
while you tell them, I'm sorry to interrupt you.
yes,
While you
sure.
tell them, would you be okay if I take some notes for the same?
Yes, please, that's fine, yeah.
Yeah. So please go ahead.
Yes, doctor, like she's unwell from last a week, I would say. She is not fine. She's having a lot of problem. She's not the girl which I know. We went to our GP twice in the last 1 week. And first he said that everything is fine with her, and then second time when we went, she had some fever and she was having some pain in her legs and she was feeling a bit weakness. So he said that she might have some viral infection or urine infection. So the GP started her on some antibiotics which she's taking. But a problem is now from last 2 days, she's complaining of chest pain. She's saying that her chest is aching a lot and she cannot breathe, and she's feeling dizzy, and her activity level has decreased. She's not playing at all. She's not eating. Most of the time, she's just sitting in the sofa and just either she will use her mobile or she will not do anything at all when I take the mobile from her. So she's quite unwell from last 1 week, but then from the last 2 days, the things are getting worse and worse.
I see, Mrs. Chairman. I understand this must be very distressing for you.
Yeah, because she's not active at all, so it's making us a bit worried that there's something serious going on with her because she's not the girl which we know. She's normally very active. She's very smiling. She would make fun with everyone. So it's making us a bit anxious.
Right. So, talking about the chest pain a bit more, as you mentioned, that it started 2 days back. Is that correct?
Yes, doctor. Yeah.
So, what would you say as what would be the location of the chest pain? Like, was it directly behind her breastbone, or was it somewhere else in the chest?
Yes, that's making me much more worried because she's complaining of chest pain on her left side. And my granddad, he had chest pain and he died from a heart attack. So it's making me a bit more worried. She's complaining of chest pain on her left side. She's saying that her left side is hurting a lot. And she's most of the time trying to hold it, saying that that's the area. And it's exactly the place where my granddad was complaining that she's having headache. And note from today morning she's saying that she's feeling problem with breathing as well. She cannot breathe, and when she's breathing, so it's making the chest pain a bit worse.
I see. That must be really anxious for you as well as desperate.
Yes,
Uh,
definitely
so,
it is, yeah.
so Mrs. Chaman, did this chest pain started slowly or was it sudden?
No, I would say it started slowly, like from 2 days. She's having chest pain, and I would say that every passing minute she's saying that the pain is getting worse and worse. Like it was a bit mild kind of pain yesterday. That's why we ignored that. The GP said that she's having infection, so we thought that maybe it's all related to the infection which she's having. But today, like she said that the pain is quite worse.
I see. And how would you characterize the type of pain? Like, is Jaspreet telling you, is it sort of a dull aching pain or heaviness in the chest which she is feeling, or a sharp pain? Could you elaborate more about that?
Well, she's saying it's kind of a heavy pain, which is causing her difficulty in breathing as well.
I see. And does it seem to also radiate to some place? Like as you mentioned, it started from the left side of her chest, but does it seem to also go towards her left arm or right arm or perhaps to her jaw?
Well, this question was asked by the triage nurse as well, but she said it's not going to any other place. It's just to the only to the left side.
I see, I see. And you seem to have mentioned it, it's associated with breathlessness also, and it seemed to worsen while she takes breaths in. Is that correct?
Yes, yeah.
Right. You also mentioned that Jaspreet was having some fever in the past 1 week associated with pain in her legs. So let's elaborate more about that. When was the fever first noticed?
So I would say when we went to our GP 7 days back, she was fine. But then the second day, like 6 days back, she started to have fever. Then I checked; it was 38.5, and I gave her some paracetamol, with which she improved. But I had to give her paracetamol quite frequently, like I was giving her every 6 hourly. Although it was the temperature was coming down with that, but it was coming back again, so it was making us concerned. So we went to and on fifth day, 5 days back, I would say, and then he examined her and he said that he's think that her throat is a bit red, and he did some urine dipstick, I think, and there was some protein within that and some, and he said that she's got some urine infection, so he started her on antibiotics. He said that the fever is likely related to the urine infection.
So the urine infection was diagnosed because there were certain proteins in the urine. Is that right?
Yeah, yes, some white cell and some protein, if I'm not wrong.
I see. And was any time in the past week was the fever associated with any rash or
No,
perhaps
no,
any
not
skin
I'm aware.
eruption?
No.
Okay, I see. And let's elaborate about the leg pain. Is do you feel that the pain is more in her in the legs per se, or you would say it would be localized to the joint area? Let's say the knees or the ankles or the wrists or the elbows.
So it's generally she's saying that her legs are aching. That's not like to only one part. Like generally she's saying that all her legs are aching, and she doesn't like walking, and she feel a bit weak. But I would say the pain has improved uh, in the last 2 3 days.
I see, I see. What about breathlessness, Mrs. Chaman? Like you said that currently Jaspreet is breathless. So is she breathless even while she's sitting, or do you think that
Uh, it starts all of a sudden. It's not like with sitting or with any activity. She will be sitting and suddenly she will say, "Oh, she cannot breathe," and she's having problem with breathing. So it's not related to like any activity or without activity.
I understand? And is she also complaining of simultaneous palpitations or, a conscious feeling of feeling her own heartbeat?
Yes, yeah, you rightfully said that. Uh, Today, I think morning she said that she think like her heart is beating a bit faster, and she said that she can feel her heart is beating a bit faster. Yeah.
Right. And was this feeling of her heart beating faster, is she feeling it more after when she does some activity or while she's simply sitting or, she's comfortably at rest?
Yes, so that's also like the her difficulties with breathing. It can start off all of a sudden without any special reason.
I see. Uh, thank you, Mrs. Chaman. And so far, I would also like to ask from you, has Jaspreet ever had any issues regarding sudden, fainting episodes or fainting attacks in the past?
No, no, no. 4 minutes remaining.
Right.
Okay.
So as you mentioned that the GP had underwent a urine examination. Apart from that, anything else was advised?
No, he just did this urine dipstick, and that's all what he did when we went to him a second time.
Right. And apart from paracetamol and ibuprofen, was Jaspreet taking anything else?
No, nothing.
Right. And what about her current activity status? Like, is she able to go to school, or does she feel too lethargic to even go to school right these days?
Well, she has missed her school from last 3 days. Before she was going nicely, but from last 3 days she not attended school.
I see. So, Mrs. Chaman, now I'll ask you a set of questions just to make sure that Jaspreet does not have any of those issues. Will that be okay with you?
Yeah, sure.
Right. So, do you think that Jaspreet has been complaining of any headaches or drowsiness in the past or in the past 1 week or so?
No.
And is there any complaints of cough, associated cough?
She had some mild cough 7 days back. But that's fine now. It's improved.
Right. And is there any associated noisy breathing?
No.
I see. As we mentioned that there was palpitations which were observed. Is there any swelling anywhere in the body noticed by you? Perhaps in the legs or the tummy?
No, I didn't notice any swelling. No.
And you mentioned that the child was having was not ready, was feeling lethargic. Is that also associated with her loss of appetite?
Well, appetite is from last 2 days is not very good, but generally she's a good eater.
Right. And you mentioned that the GP had some concerns regarding a urinary infection. So, but does she have any symptoms such as, painful micturition or blood or perhaps pus coming from the urine?
Well, no blood or pus coming from the urine, but yeah, she was saying that she's hurt when she's passing wee, and I would say like in last 7 days back, before starting this antibiotic, she was going a bit more to the washroom than bathroom than her routine.
I see. You mentioned that there was no rash, right?
Yeah, no rational.
Okay. So, Mrs. Chaman, is there any relevant past medical or surgical surgery which Jaspreet had underwent, which I should be knowing about?
No, there is nothing in the past. No, she's
Right.
like
And when she was born, were there any concerns before, during, or after birth?
no.
Right. Is she up to date on all her vaccine jabs?
Yes, she has taken all her vaccines. Yeah.
Right. And any concerns regarding her development?
No, that's fine.
Right. How has her diet been? Like, is there any recent change in her diet?
Well, like last 2 3 days, she's not eating well, but generally her diet is fine. She is a good eater.
Okay. And you seem to have mentioned that there was a history of her grandfather passing away due to
Yeah.
chest pain. So what age
2 minutes.
was that, if I may know?
Yeah, he was old. He was 72.
Right. So any other familial concerns which I should be knowing about?
Uh, well, I have got asthma. And my partner, he's having high blood pressure. I don't know if that's relevant.
Right. And how would you, towards the end, I would like to ask you that how do you think, the current illness has impacted or brought a change in Jaspreet's life and even your and your partner's life? Like how has that affected you?
Well, she's missing her school. She didn't go to school in last 3 days, and it's affecting her studies. And when she's at home, I have to take off from my work as well because I have to stay at home to look after her. And it's like I'm being paid on hourly basis. So if I miss a day, they will not pay me for that. So it's a bit of affecting in both way. both financial and both like her schooling is being missed.
I see. And so how are you coping with it? Is any respite?
Sorry, can you repeat the question? Hello? 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 Oh, I think. Hello?
Hello? So
Hello?
sorry, sir.
No, that's
I
fine.
received a call in between.
That's fine.
All right. So as I was asking, was any respite care provided?
No,
Okay. So, so towards the end, Mrs. Chairman, do you feel if there are any concerns that I haven't covered so far?
no, that's all. I'm just worried that everything is fine with her. Do you think if there's anything to worry? She's having some serious problem or?
Right. So, I have taken important notes. Thank you for your time, and I will get back to you right as soon as I can after discussing this with my team. Will that be
Okay,
okay? If you wait here
that's
for a
fine.
while?
Yeah. Yes, that's fine. Yes, sure.
Okay. Thank you so much for your time.
No problem. Okay, so it's 10 minutes. So you took 20, almost 2 minutes extra. That's fine. That's the beginning.
Right.
Okay. Before we go to summarization, what do you think, Dr. Arjun?
So, so the positive findings include like a significant history of chest pain, which is worsening on breathing. So some
Mm-hmm.
evidence, so some element of pleuritic chest pain is there. But along with that, there is, I would say, a no, an arrhythmogenic palpitations also because she is having palpitations while with even without activity. Along with that,
Okay.
there is a significant history of a sore throat infection a week
Mhm.
back, which was associated with certain urinary complaints also. So
Okay.
I feel as if it looks like a case of perhaps a pericarditis following an episode of acute rheumatic fever. I'm not sure though.
That's fine, no problem. Okay. And so let's talk about history first. So how you did in history taking?
So like the positive findings that you're asking me.
No, no, I mean to say like, what's your impression like? How you think you took the history? You did well. You need improvement.
No,
What's
I
yeah?
feel it was a sort of unstructured history which I took because I felt like I was all around the place.
Oh,
Perhaps a good reason for that was I didn't have any clear differentials in my mind. I just had like a broad idea that I should be asking about cardiac and non-cardiac causes, but
hmm.
I wasn't. Like a particular diagnosis could not struck in my mind in time. So
Okay.
perhaps it felt like I was it was a bit unstructured. So.
Okay, that's fine. Okay. Any input from anyone else? What other things? What do you think that how the history was?
To me, history taken was good.
I
Okay.
felt I felt like Dr. Arjun spent most of his time around chest pain and he was trying to find out the cause for chest pain, but the social history and the her school and head's question were important. Psychogenic aspect could have been explored more. I just felt like that.
Okay, good. Anyone else?
Should we ask about her menstruation history?
Very good. Okay. So let's start from the beginning, Dr. Arjun. You gave a lot of time to the chief complaint. You took almost 10 minutes exploring the chief complaints. You talk about the urinary symptom, I think, 3 times. I don't know why. Like you talked about the urinary symptom once, then again you came to that, and then again you talked about that. So urine, that her infection most time, and
Right.
you were jumping between the things like chest pain. You finished, then again you came to chest pain. So you are right. It was a bit of unstructured. Second thing, puberty history you didn't touch, which is important, especially in the teenager. Whatsoever the history topic is, so you have to ask about her history, puberty history, sorry. And especially if you have got any history of teenager, have you heard of anyone has heard about HEADS? HEADSS.
Yes, sir. So that's the format of taking adolescent history, home, education, schooling, drugs,
Yes.
etc.
Yeah. Have you touched anything about that?
I did not, yes, sir.
So yes, that's the most important thing. You need to know that because she's having chest pain from 2 days, and she's having shortness of breath, which is coming without any obvious reason. She's getting palpitation, which is not coming without any obvious reason. So heads is the most important thing in that. You need to know that how her home is, how her education is. You need to ask about her which level of schooling she is currently at, if she has got any upcoming exam or not. Because anyone can get an upper respiratory tract infection, or anyone can get a urinary infection that can be treated.
Right, sir.
Okay. Yes. So these are the key questions you need to ask if in case you are taking any history of related to chest pain. So history of trauma or preceding new or intense physical activity. I think you didn't ask anything, yeah?
Not trauma per se, yes, sir.
Okay. Pain associated with any particular activity such as eating or exercise.
That I think I tried to ask it for breathlessness, not pain, yes, sir.
Yes, okay, that's fine if you ask yes. So any exacerbating factor like exercise, I think this one you ask, what is making
Yes,
the
sir.
pain worse or what's making the pain good?
Yes, sir.
Yes, elevating factors, I think this one you ask as well.
Yes, sir. I covered for the medications as well and if they had any
Yes,
effect.
yes. Dyspnea, cough, wheeze, and other respiratory symptoms that you covered as well.
Yes, sir.
Yes. You ask about fever, you ask about, I would say, yes, the nutrition history you ask, so it's covering kind of anorexia. Weight loss, it's fine, no problem. Okay, cardiac related, you ask about palpitation, you ask about syncope, you ask about family history, not sudden death, but you ask about this her granddad, which mother told you that
Yes, sir. Like
she had
I tried
MI.
to ask if early familial sudden cardiac death happened, like using
Yes.
the age of the grandfather.
Mhm. Okay. Arrhythmias, previous Kawasaki disease or congenital heart disease. So you ask about past history, which I told that there is nothing.
Right, sir.
Yeah. Vomiting, heartburn, dysphagia, or GI symptom. I think you didn't ask, yeah?
No, not the. I did not cover the GI aspect. Yes, sir, you're right.
Oh, okay. So any substance abuse, you didn't touch that as well.
That no,
Yeah. Recent stressor at home or school. Any problem with anxiety, OCPs, family history of this.
yeah.
Okay. And if teenager talk about heads, which I told you.
Right, sir. Yeah, I
Yeah, so
missed that.
these are the key points I would recommend to cover when you have a history of chest pain.
Right, sir.
Okay, yeah, and I would recommend try to finish the chief complaint. Like it's important, you need to reach your differential or you need to reach your diagnosis. But I would say like 7 minutes are more than enough. Try to make them less than 7, like 6 will be enough if you focus on that. Because you know, family and social is the most important thing in UK.
Mm,
They don't want you to miss family and social. I would say you hardly give 30 seconds to uh, 30 or 45 seconds to both of them. And there too, you took 2 minutes extra and then you came to that. But if it will be in the real exam, you would have been missed family and social. Second thing, there is no particular structure. If someone is telling you that don't ask about family and social in the beginning, in the middle, or like directly after the past history. So they are just uh, telling something from themselves. There is no special pattern. You can ask anything in any way, but you need to cover the topic. If you
right,
are
sir.
asking about family and social history, if you think that you are running out of time, you can go to family and social history as soon as possible, and then you can cover birth, immunization, and development history later after family and social. But try not to miss family and social. Like in this case, development history was not relevant at all, but puberty history was.
Right, sir.
Yeah. Okay. So onset, severity, and duration. You ask character of chest pain. You ask pain, site, and its radiation. You ask associated symptoms. You ask what make it worse and better. You missed any stressor in the life.
Right, sir.
Yeah, which was in my mind the most important thing in this history. Okay, relevant for her was respiratory, GIT, and musculoskeletal system that you need to cover. Okay, so warning sign that should raise concern of heart problem: chest pain during physical exertion, exercise, or activity, chest pain and pressure that doesn't go away. So it's important to ask if the chest pain is it like she has chest pain from 2 days. So from last 2 days, it has at any point improved or not? How is her sleeping? I think you didn't ask about her sleep as well. If she's able to sleep due to this chest pain or not. Chest pain after an unexpected decrease in the ability to exercise over days to weeks. Chest pain that is followed by passing out or near. You asked about syncopal attack. Chest pain in children with heart defect. So you ask about her birth history, that's covered. Chest pain in children who had Kawasaki disease. There was nothing in the past. You asked that. Chest pain in children who have genetic cause of high cholesterol. Chest pain in children with family member who died of unexplained reason. And chest pain in children with family member who has died. So if I ask generally if this is the from all the other members, and Arjun, you as well, if you are reading this history again, I will go back to the history for a second. Where it is. You can see the history, yeah?
Yes, sir.
After this discussion with what we did. So if this is the history again you are reading in the exam, what three differentials everyone will put? I'm asking everyone. It's open question for everyone, whoever is free. What three differential would you put if you are taking this history again? So what you think that the three top differential diagnoses will be? Would you like to include in your history taking the notes which you will prepare from before in the 3 or 4 minutes before entering to the station? So what differential will come in your mind? Anyone, if you want to write, if you want to say anything is fine.
So substance misuse can be considered here one.
Okay.
I can put psychogenic cause of chest pain, costochondritis would be there. There's some cardiac pathology as well. Sudden onset.
Okay. Okay. By psychogenic, you mean the functional, yes?
Yeah, functional.
Just to clarify, because I don't know here they don't like the word psychogenic. Anyways, okay, so it's functional. Okay. Anyone else?
Panic attacks?
Sorry?
Panic attacks, I mean, due to anxiety, stress.
Yeah, yes. So I would say keep the things simple for you in the exam. If you keep the things simple, it will be easy for you and it will make your life easier. So the easy things will go. All the differential which you have said are the most appropriate rather than going into the most worst scenario. So family and social history, family history of similar condition. You ask family situation, housing, impact of condition on the family and impact of condition on the child. So you need to, yes, Dr. Shana's respiratory problem also. So you need to explore social history in detail about like how it's impacting on the family and how it's impacting on the child. And in this social bit, if you can increase the heads as well. If you have missed earlier, you can talk about heads here and see that if there is anything you have missed so far in the history, and that will add on to your history, and you might read to your final diagnosis. So these are the cardiac red flags: a past or current history of acquired or congenital cardiac disease, exertional syncope or cardiac type chest pain, hypercoagulable or hypercholesteremic state, family history of sudden death less than 35, which Arjun asked because the granddad was 72. Young onset ischemic heart disease, including inherited arrhythmias, for example, long QT syndrome, implantable cardioverter defibrillator in situ, connective tissue disorder, and history of cocaine and amphetamine use. So these were differential which I have put in my mind that I would guide you toward that. You can see, Dr. Arjun, yes? Physiological or functional, I would say. Yes. Okay. Chest infection, like someone said, pneumonia, costochondritis, it was mentioned here as well. Gastroesophageal, although she's a grown-up girl, but still you have to ask about the GI symptoms. And pericardial cage syndrome. And this is from our trust. These are the most common causes of chest pain in children who is presenting to you. So musculoskeletal is on the top, respiratory, then idiopathic, then psychogenic, then gastrointestinal, and cardiac is just 0.6 to 1%. Any question till now before I go to make the things clear? No question?
Like the history of non-exertional palpitations in this case, could that be like a good positive pointer towards an underlying cardiac pathology then?
This history which I have included, I saw this patient 1 week back in emergency. I just recently changed this history. Before it was another. She presented to me with all these symptoms. And when I went to the heads, she had her exam, her GCSE exam was coming in two months, and she was quite stressed up because of her exam. So I did an ECG for her, no doubt, because in clinical, when you are in clinical life, you will not miss anything, because if you are missing anything serious and then it comes back to you, it will be a big problem, because medical legal things are quite a lot here. So I did an ECG for her. I did a urine dipstick repeat for her. But in history, I came to know that her stressor is her exam, which is coming up, and she was quite stressed up about her exam. If you would have had here, I would have told you that yes, she is stressed about her exams. She's a good student. She doesn't like missing schools. But she is a bit worried about her upcoming exam. So that I would have told you, and that would have guided you easily, because shortness of breath she had, it was coming without any obvious reason. Sometimes the mother said that she's complaining of shortness of breath when she's sitting or when she is walking. So there is no any obvious trigger for her shortness of breath. There is no any obvious trigger for her palpitation, and we also don't know whether she has an actual she's having complaint of shortness of breath, or she's having palpitation or not. It's just a panic attack which she's having. Does it make sense?
Yes, sir. Yes, sir.
So, for example, if now let's see, this patient has come to you, so how you will manage her? After all the discussion we had so far, you have taken history, we have reached the diagnosis that you think it's the functional kind of chest pain. So how you will manage, how you will approach to her, and how you will manage her?
So firstly, like as you mentioned, I myself would like to get an EKG done for this patient just to rule out any underlying palpitation, arrhythmia. And if then attached to her a cardiorespiratory monitor, document her vitals. And if they are stable, then perhaps counsel her regarding the recent stress in her life.
Okay. So if examiner asks you that how you will approach to this child or how you will manage, try to tell after taking a complete history, I would like to do a complete examination. I would like to approach her in ABCD. Here the examiners, or even if you are presenting to a consultant, they like if you tell them that I will start with ABCD, even if the patient is stable. So I would like to do a complete head-to-toe examination. So you will look at airway, breathing, circulation. You will look at the disability, how her responsiveness is. We are following here ABPU scale. If there is any fever or any rash, so after you try to tell the examiner in that way, they will feel a bit more good that after taking detailed history, I would like to now examine the patient from head to toe. I will do a complete examination of the patient, because you are not examining the patient. You have to just make a bit of drama to tell the examiner that you know everything. So the more drama you do in the exam, the more marks you will get from the examiner. Sorry, someone was asking. So just relevant history, that's systemic relevant systemic history is needed. Like in this case, if you ask about CNS, it will not add anything to your differential, rather than it will just waste your time. Okay, so if it's a stress and anxiety, chest pain or tightness triggered when feeling stressed or worried, often this can be related to a significant event in child's life, or sometimes there is no obvious cause. So what I can do is that try to find a way to distract yourself from the discomfort. Speak to someone you trust about your worries. Visit your doctor if concern about your symptom persists. Costochondritis, someone was asking, so I was just waiting. So pain over the front of the chest, it can worsen with deep breath, coughing, or if someone presses on the affected area. So a trial of ibuprofen can reduce inflammation in the pain. If there is any acid reflux, so eat smaller and more frequent meals. Stay upright for 30 minutes after eating. Avoid things which worsen the pain, like fizzy drinks, acidic, spicy, or high-fat food. Avoid ibuprofen because it can irritate the stomach lining further, and contact your doctor if symptoms persist. So these are the takeaway message you will give to the parent if in case you are discharging our pericardial cage syndrome. So here, after doing a history examination, you will like to do investigation. So investigation, you will just tell the examiner relevant, like if she's on the history, you think that she had got some fever still. So just to make your you will do an ECG, you will do a urine dipstick, repeat just to make sure she still hasn't got any urine infection. You will do a full blood count CRP. She had fever, so just to make sure that she's not anemic, especially if you have asked about her period, if they are regular and normal, if she is bleeding nicely or she's our blood, so you have to make sure that she's not anemic, which can also sometimes cause a symptom. CRP, just an acute phase reactant to make sure that she's not having any infection. So in this way you can proceed. Any question, Dr. Arjun, till now, or anyone?
No, sir.
So generally, I would say your history, your approach was good, but you need to a little bit give it a structure. Try to structure it as much as possible. Try to finish thing, like if you are talking about fever, try to finish the fever now, rather than you will ask about fever now. You will go to cough, shortness of breath, and then again you will come to fever. So I'm just giving you an example. So like the way you did with urine infection, if you are asking about some particular symptom, try to finish it, and then move on to the second, and then to the third, and then to the fourth. Although we are humans, everyone forgets something. So if in case you think you are missing something, you can come back to that. But repetitions is what will give it a bad look or bad shape, that you are coming, like if you already passed once that's topic and you come back, that's fine. But if you are taking again and again these repetitions, so then it will not have a good impression. Once is fine, but try not to make the repetition again and again. Try to finish the chief complaints at least in 6 minutes, or at the most in 7 minutes. If you think you are still running out of time, try to focus on family and social history, and cover the remaining if you still have time. Quickly ask about F-bind if in case you have enough time, and you are then going to family and social history in the end, because here sometime family and social history might be quite a lot, and it might waste your time as well. So if you have enough time, then finish F-binds and other bit in the F-binds, and go to family and social history. And if you are short of time, try to finish family and social history fast, first before going to the other, and in the end just superficially ask about the birth history, immunization history, puberty, and all these things.
Great, sir.
Okay. Yeah. Yes, Dr. Lynette, I think she want to ask any question.
Yes, sir. Regarding the management, when the examiner asks you about what is your management in this case, then we just have to give the management for our differential. Suppose in this case we think that it is functional, then we tell only about the management for the functional case, or do we have to give management for the other